Hello, my name is Sonia Cobb, and I am the Director of Housing Services for the province of PEI. Thank you for taking the time to tune in to this information session from Housing Services. We hope information provided in this session will help you in your day-to-day work and help your clients locate supports and services that might be helpful to them. This session is driven by work supported by the Community Housing Fund. This fund is a partnership between the province of PEI and the PEI division of the Canadian Mental Health Association. Since 2018, the province has provided $9 million to the Community Housing Fund to administer projects that increase options for islanders most in need of housing and related supports. In 2020, a needs analysis of housing supports in Prince County was completed as one of the Community Housing Fund projects. One of the recommendations from this work centered on increasing awareness of and connection to housing supports. This included training and information sharing to frontline service providers. Today's session will cover what supports exist for islanders in need of housing support and how to access them. In addition to housing services staff, the United Way of Prince Edward Island will join us to give an overview of the 211 service. To begin, Amy McManus from the United Way of PEI will join us to give an overview of the 211 service.
As frontline workers, you end up being the ones to field questions about anything and everything. Very often they are questions you can answer, but what about the ones that don't pertain to your work or you have no idea where to direct an inquirer? Well, there is a service out there that can help you, 211 PEI. It's a navigation service that is available across Canada and the US, and it has been live in PEI for just over a year. It's the service to use when you don't know where to turn. It's multifaceted in that 211 can be accessed by phone, website, email, and text, with the star component of the service being the phone piece. 211 PEI navigates people to critical, social, human, community, and government services across the island. The phone service is available 24 hours a day, 365 days a year, and is a live answer service. When you call through, you pick English or French, and then you're connected with a navigator. If another language is required, that's not a problem. Simply let the navigator know, and they will instantly connect through with the translation service that has access to over 150 languages. And each call is free and completely confidential. Someone isn't comfortable calling? There's a searchable website that contains most of our records at pe.211.ca. A search can be done by keyword and/or location, but it isn't Google, so it might be a little trickier to get the result you're looking for. To make it easier, there are topic categories with subtopics and definitions that will help people navigate to the services that they need. In addition, 211 PEI can be reached by emailing help@pe.211.ca or by texting 211. And both of those are responded to Monday to Friday, 9 a.m. to 6 p.m. Still unsure if you should send someone our way? There is no wrong call, truly. We receive calls that range from what is the weather forecast for today to I am having suicidal thoughts and everything in between. So this slide demonstrates a variety of services listed in the 211 PEI database. As you can see, there are a variety of services and people can reach us for almost anything. And the service is for everyone. Service providers, individuals, caregivers, and family and friends inquiring on someone else's behalf. The phone service, as I said, is where 211 really shines. Every call is a personal experience and there is no time limit to each call. It's very much a one-on-one conversation between the caller and a highly trained navigator. Navigators use compassionate inquiry to find services that meet the caller's needs. Very often people call with one need, but through the conversation, multiple needs are identified and the caller walks away with referrals to several services. For example, someone might call with a housing need, but through the course of that conversation, it may be determined that there's a greater need for perhaps counseling or food supports, or maybe the caller mentions that their friend is wanting to adopt a cat but doesn't know how to do so. The 211 PEI navigator would provide referrals to all those services. So how will navigators or the public using the website be able to assess the appropriateness of a service? All 211 PEI records contain enough information to make that assessment. Records contain information on an overview of the program, contact details for the program and the organization providing it, eligibility criteria, the first step in the application process, whether there are fees, what documents are required to access the service, the hours of operation, website link, where the program is located, and disability access for that location. So as you can see, 211 PEI is a great tool to have in your toolbox as a frontline worker.
Thank you, Amy. Housing Services offers a variety of different programs under social housing to seniors, families, and/or individuals. Chelsea Mary will now give us an overview of some of those programs and how to access them.
Housing Services has a variety of options available to people eligible for social housing through the Seniors Housing Program and the Family Housing Program. The Seniors Housing Program includes anyone who is 60 years of age or older, or anyone who is at least 55 years of age with a disability. The Family Housing Program consists of singles or couples with or without dependents who are under 60 years of age. Any individuals who are receiving social assistance or assured income through social programs receive a shelter allowance through that respective program. To be eligible for our social housing programs, an applicant's gross annual household income must be less than the income threshold for their needed unit size. Applicants must also meet at least one of the following core needs. An applicant must need either adequate housing, which is housing that doesn't need any major repairs as reported by the residents. These major repairs can include defective plumbing or electrical wiring, or structural repairs to walls, floors, or ceilings. Or suitable housing, which makes sure that there are enough bedrooms for the size and makeup of resident households, and this is measured according to the National Occupancy Standard. Or affordable housing, housing that has shelter costs equal to or less than 30% of the total before tax household income. There are 3 service options that applicants will be assessed for to determine which service best suits their needs at the time of application. These services include government-owned senior or family housing units, rent supplements, which are units in the private sector that the government has long-term leases with. With rent supplements, PEI Housing partners with private landlords and developers. These supplements are not portable because they are attached to a specific unit with the developer. So if a tenant leaves a unit, a new rent supplement tenant would be selected for that designated unit. Housing pays a rental amount for each unit directly to the landlord and collects rent from the tenant based on either 25% of their gross monthly income, a minimum rent, or a flat rate from social programs. The last service is a mobile rental voucher, which is a financial rental assistance for clients who have a unit or find their own unit in the private market, and government helps pay a portion of the rental cost to make the unit affordable. These units must be both suitable and adequate, where affordability is the only issue. Housing Services can subsidize a portion of the applicant's rent in their current unit up to the Housing Services rental ceiling rates, which I will mention on the next slide. This subsidy is paid directly to either the client or the landlord each month and are portable if the client were to move. The processes for these services vary. However, each service begins with a housing officer completing an assessment with the applicant. Once an assessment is completed, the housing officer works with that applicant to match them to the best option for their current situation. Housing Services collects tenant rent based on 25% of the gross monthly income, a minimum rent, or a flat rate for those tenants who are in receipt of social assistance. All of our services are calculated on a rent-to-income scale. Households who are not in receipt of social assistance pay 25% of their gross monthly household income. A minimum rent is $100, and no rent will be set lower than $100. If a household's only source of income is social assistance, a flat rate will be applied, and social assistance will pay the rent directly to Housing Services. In a mobile rental voucher, a tenant pays 25% of the household gross monthly income, except where the rental unit is greater than the program limits. In these situations, the tenant is responsible for their 25%, as well as any amount over and above the Housing Services rental ceiling. Our rental ceiling rates are as follows. The 1-bedroom rate is $794, the 2-bedroom rate is $961. The 3-bedroom rate is $1,118. 4-bedroom rate is $1,191. And the 5-bedroom rate is $1,242.
Thank you, Chelsea. In addition to social housing programs, the division provides support to low-income islanders looking to make structural improvements to their homes. Megan McDonald, Home Renovation Program Coordinator, will provide some more information on these programs.
I am going to provide a brief outline of the PEI home renovation programs. The goal of the PEI home renovation programs is to assist homeowners with essential renovations so that they can remain in their homes. PEI home renovation programs is broken down into 4 different programs. The first program we have is the PEI home renovation program. Homeowners can apply to receive a grant in order to assist with the following types of renovations: heating, electrical, structural, plumbing, or renovations that relate to life safety. Examples could include replacing a roof or installing an oil tank that is reaching expiry. We also have the Seniors Home Repair Program, which assists homeowners over the age of 60 with the same type of home renovations as the PEI home renovation program above. The third program we have is the Senior Safe at Home program. This program is for those applicants over the age of 60 who own their own home, have life interest in the home, or live with family members, and are looking to improve the physical safety of their home. Examples of renovations could include constructing a ramp to access the home, moving the washroom to the main level of the home, or renovating the bathroom to make it accessible. And lastly, we have the Disability Grant. This is an extension of the PEI home renovation program and assists those with a permanent disability to access more grant money to help accommodate their disability. Homeowners can request a medical verification form to access this program. In order to be eligible for the PEI home renovation programs, the combined household income has to be $50,000 or less. You have to be a Canadian citizen, landed immigrant, or a permanent PEI resident. You have to be the owner of the property or have life interest in the home, and your property value has to be $300,000 or less. The property has to be your principal residence, and you have to be currently residing in the home or have not reached the current maximum grant through previous applications. I would also like to note property value does not apply to the Senior Safe at Home program. Here's a table that outlines how much of a grant applicants may receive for each program, and it is based off the combined annual net income of all homeowners and occupants who reside in the home, excluding those who are aged 18 to 25 years old who attend school full-time. Other important information to note when applying for the PEI home renovation programs includes: the renovation must be approved prior to being started. If a homeowner received a grant and sells their home within 3 years, it can trigger repayment of the grant. Eligible renovations must satisfy a need to have, rather than a want to have, cosmetic upgrade to their home. Homeowners can reapply for the PEI home renovation program 15 years after they reach their maximum grant. Applicants will be asked to submit 2 quotes for each renovation that they are eligible for, and lastly, grants decline as the income increases from $35,000 to $50,000 as seen in the previous table. In order to apply, homeowners can access their applications online at the PEI Home Renovation Program's office at 161 St. Peters Road, Charlottetown, or at any of the Access PEI sites across PEI. They could also call 1-855-374-7366 or email homereno@gov.pe.ca and we can send them an application. I would also like to note that there is also the Seniors Independence Initiative run through the Social Programs Division within our department that offers support such as transportation, grass cutting, snow removal, and housekeeping to seniors to help them remain in their home. To access more information regarding this program, you can call 1-877-569-0546.
Thank you, Megan. Finally, Housing Services provides emergency and supportive housing to islanders experiencing or at risk of homelessness. These supports are offered in partnership with many community partners across the island. Shelley Cole, Supportive Housing Manager, will provide some more information on what is available for islanders in need of emergency and transitional housing.
Good morning. My name is Shelley Cole, and I am the Supportive Housing Manager with Housing Services, the PEI Department of Social Development and Housing. Today, I'd like to talk to you about the range of housing supports available, including the emergency housing line, emergency shelter options, supports provided through the Provincial Housing Navigator, supportive housing options, and the Community Outreach Center. I also want to share with you some of the measures being taken to address data collection and information sharing. I'm happy to answer any questions you may have, either today following my slides, or we can always connect outside of today's presentation. The emergency housing line is a line that can be accessed 24 hours a day, 7 days per week. There are a variety of reasons that individuals call this line, including advanced planning for self, calling on behalf of friends or family, and to address emergency shelter needs. Staff answering the line are using a diversion-focused approach, gathering information from callers about their particular circumstances and discussing options, with the idea that statistically speaking, individuals who do not enter a homeless shelter are less likely to experience homelessness. Staff answering the line are able to provide callers with information, make referrals to service providers, including the Housing Navigator, and complete warm transfers for shelter placement. In terms of emergency shelter options, there are currently 3 shelters offering services to female identifying clients. In Charlottetown, Blooming House offers 8 beds between the hours of 4 p.m. and 8 a.m. The Chief Mary Bernard Shelter is located on Lennox Island, offering 5 beds, operating 24 hours a day, and providing supports to women and children. Anderson House is located in Charlottetown, offering 8 beds, operating 24 hours a day, and focusing on women and children fleeing violence. For male-identifying clients, services can be accessed at the Bedford MacDonald House in Charlottetown, where 10 beds are available between 4 p.m. and 8 a.m., and the Deacon House shelter, which has recently been located at 35 Weymouth Street in Charlottetown, offering 6 beds for male-identifying clients between the hours of 8 p.m. and 8 a.m. The Housing Navigator is a relatively new position to government, intended to support complex clients. The Provincial Housing Navigator accepts referrals from government and community, completes assessments for provincial housing options, rent supplements, and supportive housing, and provides case management for a limited number of clients, and is the central point of contact for housing for complex clients with other government agencies, including mental health and addictions, health PEI, and corrections. The Housing Navigator supports complex clients. These are clients who may be experiencing homelessness, may be experiencing mental health and addictions issues, may have been recently incarcerated, have poor rental history, may be in arrears with the department, have behavioral issues, and will most likely require case management supports in order to be successful. For these clients, supply cannot be the only issue. Most of the clients that are supported by the Housing Navigator require navigation assistance. The Housing Navigator works to attach clients to services, receiving and completing referrals, and helping to address the specific needs of the client. The Housing Navigator takes a collaborative approach, working closely with community partners to support clients in emergency housing situations, to access supportive housing, and generally to navigate systems. The Housing Navigator is the main link to the Community Outreach Center, operating out of this space 3 half-days per week, participates in case conferencing, and is a member of the Coordinated Access Service Provider team. The province is currently working with community partners to provide supportive housing options. There are 2 types of options being offered currently. The first is a scattered site supportive housing, which can be offered in all locations of PEI and is currently being offered at 10 units in a former motel in Charlottetown. Interested individuals are assessed for readiness using a standard assessment tool. Individuals must be willing to participate in case management, and a case plan is developed with the individual identifying where support is required. Individuals must be eligible for financial assistance either through a rent supplement, social assistance, or have their own income to contribute toward the unit cost. The individual will be supported for a period of time ranging between 1 day and 18 months, with the intention to help prepare the individual for independent living within the community. The second option being offered is a single-site supportive housing, which is currently being offered in the former Smith Lodge at 35 Weymouth Street, where government has partnered with the Salvation Army to deliver 9 beds for male-identifying clients who are interested in active case management and living in a supportive housing environment. The Community Outreach Center is a project that opened in January of 2020. Leadership and oversight is provided by a working group made up of community-based organizations, including the Canadian Mental Health Association, Peers Alliance, and NCPEI. Government holds a contract with the Salvation Army for the delivery of this service. The Community Outreach Center provides 2 main functions. One is to provide access to service, bringing services to clients where they are. The second function is to act as a warm or cool space when other options are limited. The Community Outreach Center provides services to clients aged 18 plus, the majority of whom are experiencing homelessness, seeing an average of 35 people per day, who are looking to access supports around housing, finances, counseling, cultural and employment supports, and access to safer supplies. The Outreach Center operates 12 hours per day, 7 days per week, and has recently moved to 241 Euston Street in Charlottetown, the former Charlottetown Curling Club. And finally, today I wanted to talk to you about data collection and information sharing. So this is a gap that has been noted by stakeholders, by community organizations, and by government itself. There is a need to address the provision of data collection and information sharing. We have been moving toward a standard data collection process, identifying key indicators, looking to track the effectiveness of recent and future funding initiatives and partnerships, moving forward with the implementation of coordinated access and HIFAS. So coordinated access, of course, is the system that provides equitable access to housing regardless of an individual's situation, and HIFAS is the database management tool that is used to support the collection and sharing of information in a confidential manner between service-providing organizations. All of these measures will lead to better evidence-based decision-making, where future decision-making and resource allocation by government and community can be enhanced in an effort to better support clients. Thank you.
Thank you, Shelley, and thank you to each one of you for taking part in the session. Thank you to our viewers and frontline service providers for taking the time to learn more about housing services available for islanders in need. I encourage you to share this information with your colleagues. If you or a colleague has follow-up questions on content in today's video, please do not hesitate to make contact with our office.